Hi there, everybody. Dr. Crystal Tellier again. Just had another thought as I was out here hiking in the snow and wanted to talk about dental hygiene. This is something that's been near and dear to my family really the entirety of my life. And we used to joke that when people would ask, who's your primary care, I would tell them my dentist, because I really was not a very sick kid, so rarely saw my doctor. But dentist my entire life, every 6 months, and have continued to do so into my adulthood, because I think dental care is extremely important. What we know about our teeth and the area that it shares is that it's really important for cardiovascular health. And I have shared with you guys that I have a big family history of cardiovascular health, so anything that I can do to keep that space healthy and just disease risk-free is important. Also important to have a beautiful smile. See, I don't have any cavities. I'm in my 40s. The only fillings I ever have are just the natural kind of cracks and grooves that come together just through the chewing process through your life. My two kiddos, which are more adults now at 16 almost and 19, have no cavities. And some of the things that we've done in our household, obviously try to limit sugar when we can. Huge on brushing our teeth both morning and night, flossing, water picks. We do not drink fluorinated water, but we do use fluorinated toothpaste. And on occasion through younger childhood did elect to do some of the fluoride topical treatments just to reinforce the strength of that. And that has seemed to work for our household. Cool little news article that was out was Utah electing to ban fluoride treatment in the water system. And I supported that because it's back to that conscious consumer. I want to know what's in my water. I want to know, what is going on so that I can make that choice. The reason we don't drink it in our household is I want to make sure that we preserve our thyroid function, because it can interfere with our hormone production and decrease our quality of thyroid, which is so vitally important for all of our body. Other thing that I have noticed in clinical practice is I do find that families that elect to not use fluoride do seem to have more cavities, even with really healthy diets. So it is something that I've seen reinforced time and time again. I wanted to add also that in clinical practice, I have seen what feels like a larger incidence of cavities in the children in my practice that do not use topical fluoride within their toothpaste. And so that's been something that has been really reassuring to me, and what my practice philosophy is for my household, and also how I educate my patients. You want to use fluoride in your toothpaste and that works for you and your family, great. You want to go fluoride free and that works for your household and your family, awesome. That's the beautiful thing about this country, is we get to make those kinds of choices. So be well, brush your teeth, go outside, move your body, and smile. Show everybody those pearly whites, and take good care of your teeth, because it matters for the entirety of your body's health and wellness.